Today, I am joined with Mr. Ozone himself, Micah Lowe. Thank you so much for being here. Today, we are going to discuss how ozone therapy, specifically rectal insufflation, could be a possible huge benefit for people with Crohn's disease, ulcerative colitis, lymphocytic colitis, or other forms of IBD. Micah, thank you so much for being here and bringing your awareness, your knowledge, your years of experience. Thank you so much.
Yeah, thanks, Dane. I appreciate it.
You're very welcome. And I'm so excited for today's conversation. We're going to be going over what is ozone, how does it work in the body, how could it potentially help with autoimmune disease or people with IBD. And then what I'm going to be doing is also showing you how I use my ozone machine back here. So hang with us and I'll show you exactly how I use it and break it down. And for those of you who don't know, I nearly died of Crohn's colitis in 2014, first diagnosed with ulcerative colitis with gastritis, then diagnosed Crohn's, then UC. Eventually just started calling it Crohn's and colitis. And for the last 8 years, myself and my team have been helping hundreds of thousands of people all around the world reverse Crohn's and colitis with Crohn'sColitisLifestyle.com and the S.H.I.E.L.D program. So we want to move forward with integrity. We want to discover. We want to grow together and see what we can do. So Micah, I know you've prepared a presentation for us today to really understand ozone. So let's jump over to that. And then let's talk about what is ozone and how can it help. Okay, so you can pull up that presentation when you're ready and we'll dive in.
Perfect. Yeah, man. And I appreciate it. You just having me on and being able to talk about this. I'm super passionate about it. It's helped a lot of people as well. And by the way, I love the program you guys have. Super impressed with what you've built. And I love that, you came from a place of healing your own problems, because that gives you so much intimacy with the state itself and how to work with it. So huge kudos to you and your team for being able to do that. But so we're going to be talking about ozone therapy. So we're going to get into kind of a higher level. What is this thing? How is it going to help with Crohn's colitis? How does it help with inflammation and gut health and the different ways that you can use it? So we're basically first going to cover a little bit about safety, then we're going to get into the meat of it. And then, as Dane said, we're going to be showing like the equipment and how to apply it and different ways that this can be implemented into your own house. Almost said it in a Canadian accent there. All right. So essentially what I'm going to show you over the course of, maybe 45 minutes, maybe not quite 60, but is just how you can use ozone therapy and hopefully turn you into raving fans for this treatment and be able to help you guys out with what you're looking for. So if you don't know who I am, I've helped in popularizing ozone therapy in the United States. And I essentially got into this because my brother had a form of rare brain cancer. Going through the Johns Hopkins medical system, it really deteriorated his quality of life because they were doing a lot of experimental stuff, and it's a really long story I'm not going to get into too much. But we actually started this project and worked on it together for about 6 years. He did pass away, but from that came so much good because it's now helped hundreds of thousands of people 10,000 plus more doctors have been added to this treatment. So it's really had quite a reach based on the work that Matt did with me when we first started this. So we came into this kind of as what would be things that can help Matt and, the issues that he was facing. So we found hyperbaric oxygen, and then that got into ozone therapy. So now I have a company called Simply O3 that has ozone therapy equipment and training. So although I'm kind of a business guy now, I'm really passionate about the health side of things. And that's where I got my start into this industry, is just like, how can I produce something that's helpful for people? And so hopefully they can avoid a situation like Matt's, or hopefully if they get into that situation, how can we reduce the negative side effects of some of the treatments he was doing? And there is good research on it. So some good stuff there. And I would say my goal in life is to reduce suffering in the world. That's really just kind of my beckoning call and what I'm here for, I suppose. And I'm a family guy. My wife and I have 4 kids, so it's awesome.
Micah, let me interject there real quick, because that was really great. And how I got involved with you is when I did Ben Greenfield's podcast, he actually recommended your ozone therapy to me. And then so we met, and then I ended up getting one myself after looking at this research. So it's very exciting. You hold a lot of esteem with a lot of big functional doctors and practitioners all around the world. And I think this is not one of the best, if not the best, ozone machine and therapy that can be done. And everyone out there who's wondering, okay, what the heck is this? I was wondering for years. Hopefully this meeting, if we can really get through it and really understand, is going to really validate what is ozone, how does it work, how can it help you with your gut health. Thank you so much, Michael, for what you do as well.
Yeah, I appreciate that. Yeah, it's kind of cool because we're really well connected into the industry. All the big names you can think of, Hollywood, really well connected there. Gwyneth Paltrow actually just went on a podcast and was talking about rectal ozone. You know how hard it is to get actresses and actors to talk about it? Like, it's not easy. So if one
Let's
says
talk
it,
about it. Yeah. Well, we
like,
don't have that shame here. Everyone here is listening to myself. We're going to talk all about rectal ozone and how to heal that colon up.
which is why I love you guys. There's no stigma surrounding it. You
There's
guys are
none.
just ready to go. Let's just find the thing
Let's
that works.
let's do it. Yep.
So, well, what is ozone? We should probably cover that real quick. So, ozone is a gas. It is O3, whereas oxygen is O2. So, it's pretty similar in its chemical makeup to oxygen, but it has a third oxygen atom on there, which makes it unstable. But that gives it all the beneficial properties that we want from it. So the ozone therapy part comes in when you take this gas and you apply it into the body in some capacity. So that can be done as an IV. It can be done, like you said, rectal insufflation, which is probably the best if you have like Crohn's colitis, and we'll get into like why it helps with that. But there's a lot of different ways to apply it. So you'll see people using it for ozone water, ear insufflation, limb bagging, all this different stuff. As far as you guys are concerned, you don't need to think about all that. Really, just rectal insufflation is probably the one to keep, in the back of your head. Maybe some IVs if you're trying to decrease some of the inflammation. But between those two, that's going to be the best bet for Crohn's colitis.
Rectal insufflation, just so everyone can see right now as we dive in, it's using a bag that holds the gas, and then something like this, a small catheter, very tiny, much smaller than even your pinky, can go in there, administer the gas, and you're done. And so that's what we're talking about with rectal insufflation. But let's keep going with what ozone is. And by the way, is it a common misconception, or is it true? It's also the type of gas that we see in the ozone layer in the earth. Okay, so when we go through the ozone layer, it's the same thing.
Yeah, I mean, obviously we're using a medical grade,
Yes.
but yes, it is ozone. So it's O3 is up there, and O3 is coming out of our generators. It's just, purity. Obviously, we're using like pure ozone, that kind of thing. But
Yes.
the molecule itself is the same. But yeah, that kind of blends right into this because a lot of people have like, isn't there the ozone layer, or isn't ozone a pollutant? So there's a lot of this like half information or things that people have heard about. And so people come to this thinking like, well, I've heard that's not good for you. So what's up with that? So we're going to real quick go through safety. But there's essentially 5 different areas I look at to inform myself. And I think the evidence is pretty overwhelming on ozone and how it can be applied. I'm going to list these off and then dig into them slightly more. But 5 areas I look at: biochemistry established, approved in over 20 countries, made it through FDA safety standards, which is, the governing board for regulatory on medicine. There's clinical reports on it. One is over 300,000 treatments assessed. This says over 2,000. It's actually over 2,500 medical studies on ozone now. And there's over 10 million treatments done per year. When it comes to the biochemistry, the reason why people kind of get stuck on ozone or are like, isn't that dangerous or something that you can't do if you Google it online? The reason is because you can't breathe ozone. So if you breathe ozone into your lungs, it's irritating. It's not dangerous, but it is irritating. And over a long period of time, if you're in constant exposure to it, it could actually cause like prolonged or sustained irritation to the lungs. So like coughing and things like that you would get from it. But there's a reason why you can't breathe it, but it can be applied to other parts of the body. And the reason for that is because when you're breathing in, what are you breathing? You're breathing oxygen. So you're an aerobic person. You need to be able to breathe in oxygen. So your lungs don't have what's called an antioxidant buffering system there, so that you can take that oxygen in and use it to create energy. Because if we had an antioxidant buffering system there, we wouldn't be able to take in oxygen very well because it would bind with the antioxidants. So we actually don't want that there. But that antioxidant buffering system is in pretty much every other part of the body. So when we take something like ozone and we apply it to, say, the blood or into the colon, it's going to interact with the antioxidants there. And that's going to start what's called a cascade effect, which is where we get the benefits from. So essentially the ozone goes in, interacts with the defense mechanism called the antioxidant buffering system, and then we get the beneficial properties from there. So that's why you can use ozone in different parts of the body, but not the lungs.
So you can't breathe. You don't want to breathe in the ozone. It's an irritant to the lungs. That buffering system allows it to work everywhere else in the body, but it's safe enough that people are actually using ozone, for example, to clean their teeth.
Yeah, and you
So
can.
you can, it's okay. You just don't want to keep breathing it in, but it can be used for the ear. You clean your teeth, rectal. People are even putting it into their bloodstream.
Yeah, and exactly. And a lot of the research is done in situations where people are like exposed for years on end to it.
Yeah.
So in pollution, or they work in like a commercial sized laundromat where they're using generators, and they used to just pump them into the air and didn't really care. But that's bad for the long term. But it can be used in all these other ways very safely. And that was actually verified too by the FDA itself, ironically, which they if you go online, you'll see a different stance that they take. So they're kind of talking out two sides of their mouth. But on
Mhm.
one side, there was a company called Vasogen that put in $225 million in research. Essentially what happened, just to keep it super short, business guys came in, they talked to the scientists. Scientists said, let's do ozone therapy. And business guys are like, well, I want a really like big disease so that we can make a lot of money. So let's do chronic heart failure stage 3. Scientists are like, I don't think that's a good idea, but let's do it. So anyway, they get through stages 1 and 2 of FDA trials, which establishes safety of the therapy itself. And then they get to stage 3 and they study it for chronic heart failure stage 3. And what they're looking for is, does it reverse heart damage that's been done? Scientists already knew this going into it. It wasn't going to work, but they're going to take their money. So they ended up finding that it doesn't reverse that damage. And then the scientists produce the report. Business guys go, oh, you mean we're not going to make a asinine amount of money from this? And they go, yeah, unfortunately. So they pull all their money out and the thing folds. They could have pushed through if they wanted to. If they should have done a different disease, essentially, is what happened. But did get, the FDA wrote off on it and said, yep, safe. Yep, it does work to a degree. And they didn't assess it from a lot of different angles, like all the different diseases you can look for. They were primarily looking just at chronic heart failure stage 3. But it was very credible in the research that they did there. And then on top of that, there's clinical reports that are done. This is the one that has over 300,000 treatments. The adverse event rate was lower than the use of aspirin, like one of the safest things that we know of. And so it's extremely, extremely safe according to that clinical report. And
This is being used all over. I mean, there are clinics using ozone all over the United States and specializing in ozone. So this isn't
yeah,
something new, and people have been using it for 10, 15 years. I mean, I've seen clinics all, New York, Florida, LA, of course, a lot of big cities, and people are, many doctors around the world are using it. So there's a lot of experience there and data, and as you're saying, these medical studies to back up the safety and efficacy and effectiveness of ozone.
yeah, it's in every major city in
Yeah.
multiple disciplines. It's like you can go and get IVs, or you can go and get aesthetic injections for like hair loss. You can go into a dentist and they'll use it. You can go into joint regeneration for like torn joints. Like it's used in all these different disciplines and quite in depth. Yeah, for sure. And then on top of that, there's over 20 countries that have approved its use, and that's growing every year. When I first kind of came into this, it was like 8. So every couple of years, there's a few more countries added. So it's kind of gaining some momentum on that side of things too. So I think within 10 to 15 years, we'll see it approved in the United States. It's just a pretty long process and it's very expensive. So it takes some time to do that kind of thing. But we'll see, or it could be sooner. I have no idea, but that's kind of what I'm thinking.
Beautiful.
And there's over 2,500, this is 2,500 medical studies on it. And those range in credibility. So some of them are like the most credible study that you could ask for, and it's like done wonderfully and all that kind of thing. And what I mean by credibility is that it's like very repeatable, very scientifically done, very expensive. And then on the other side, you have doctors that are seeing patients and, they just make observations. So they like would say, I had 5 patients with this thing and I applied ozone and this is what I saw.
Yeah.
But the overall theme I'm getting from all these studies is its safety. Incredibly safe. I mean, over 2,500 medical studies verifying that. That's hundreds of thousands of patients.
Wonderful.
Within that. And there's over 10 million treatments done per year. But let's get into the good stuff. So what does it actually do? Well, on a very base level, it's helping with inflammation. But there's a level beneath that I think is pretty important for correcting things like inflammation or correcting things like the immune system. And these are the 4 fundamental aspects of ozone therapy that I like to point out. It does more than that. And then I'll kind of tie those into inflammation and how that works.
Okay.
But essentially, it works with the immune system by balancing it out. So some people have an autoimmune disease, and that's when the immune system is attacking the body. So in that case, it would actually quiet down the immune system. On the other side of it, if somebody's like really sick, they have a lot of bad bugs in their body, and their immune system isn't working, it's not killing off the bad bugs. Well, it raises it up. That's called an immunomodulator when it balances the immune system. And ozone is really good at doing that.
Well,
The second thing is it works with Yeah, go ahead.
well, I was going to say right there, that's hugely impactful because there's no really natural therapies to balance the immune system. I mean, we see in conventional medicine, we try to balance it with Imurin, azathioprine, those types of immunomodulators, but they're drugs and biologics. This is helping as a catalyst for the body to naturally balance itself, correct? So this is a
Yeah,
safe,
yeah. And
natural therapy to balance the immune system. If someone was very low and their white blood cell count was low, or they're hyperactive with Crohn's colitis, this helps to act as a catalyst to naturally balance the body in a safe way. I mean, that's revolutionary.
Yeah, it's super helpful, super important, and it's really good at doing it. So it really, and when you autocorrect or when you correct something like that, it causes autocorrection in a lot of other parts in the body. So that's why these four things are so helpful, is because we're working with your ability to use oxygen, your ability for blood to flow throughout the body and get nutrients and gases to where they need to go. Then we're working with oxidative stress, which is essentially when you get too many of these things called free radicals, and it starts to break cells down. But it works with those four different things, and you can set inflammation right on top of that. And once you correct this down here, that inflammation starts to reverse into a healthier state. So that chronic inflammation can be extremely helpful with. And I'm not saying like this is the tool in the box that's going to solve all your problems. Obviously, this is one of the things, and there's the aspects of lifestyle and diet and what that looks like that are going to be the heavy lifting.
Yeah.
But introducing something like this can I would say either accelerate where somebody is at or be kind of that incremental last, those last pieces that they're starting to plug in and be helpful. But you couldn't apply this and outwork like a bad diet if you have Crohn's colitis, it's just never going to fix it.
And Micah, if I can interrupt you for a second, just to say, as someone who's been working in Crohn's colitis and natural medicine for the last 12 plus years, there are very few tools in our toolbox that can do what this does. And so I want everyone out there to listen that when we look at how do we recalibrate the immune system naturally, well, we have food, we have de-stress, meditation, sunlight, those types of things, but actual alternative therapies to modulate the immune system and recalibrate the body. It's not that much. And this is something that's safe, that's effective, that we've been doing. We're seeing a lot of members staying in long-term remission and getting great results using ozone. So I think, Micah, for us and what we've seen, one of the reasons I want to be here today and talk with you is the profound experience we are seeing and the potential of what this could do long-term. I mean, for those who are stuck on biologics, is just suppressing the immune system for life, or those stuck on steroids, or those stuck with this hyperactive immune system that diet's not doing it, or even meditation's not doing this. This is a legitimate alternative option we can use as part of our whole plan, right? To you said, as we change our diet, as we work on our stress, this is a viable option we can really consider here today to say, can this help mediate my immune system response long term in a safe way? That is exciting. And Micah, I'm just very pumped for it.
Yeah, and we'll get into the balance thing here in a second, but you also just reminded me this was pretty largely used in Cuba for a really long time, which I'm not saying that's why to do it, but it's kind of interesting because Cuba, Fidel Castro came in and essentially established a pretty bad government, and they got, the United States didn't want to have to do with them and all that kind of stuff. So economically, they really declined. Like if you go back there, they're still using cars from like the 50s and stuff. Like it's economically just doing really poorly. But for their hospitals and for their standard of care, they had to choose things that would be really inexpensive, that would work for a lot of different diseases, and was pretty easy to apply. And one of the things that was very commonly used was rectal insufflation. There was an entire hospital, believe it or not, that was dedicated to this through Dr. Sylvia Menendez, and you can look her up. She has a lot of literature out there and research, like just on all sorts of crazy stuff you would never imagine being rectal insufflation being used for. Is like, how does that work with chemotherapy, or like all this kind of cool stuff. But for a very long time, like hundreds of thousands of patients in these studies that they've done. So pretty cool. But this is oxygen efficiency. So let's, this is important. So essentially, as we age or have disease, our body loses its ability to use oxygen. And what that means is it's not how much you're breathing in, that's just how much oxygen is being carried into your lungs. But how well your cells actually take and convert oxygen to energy is a very fundamental aspect of the body. And what ends up happening as you get sick or as we start to age, we can't get rid of this thing, right? Like we are going to be going downhill to a degree as we get a little bit older in terms of physicality. Obviously, like character and like those other things get better with time, but physically we reduce in our ability to recover or deliver oxygen, reduce muscle mass, more likelihood Alzheimer's, dementia, failing mitochondrial function, and that is directly correlated with our ability to utilize oxygen. So one of the things that ozone has been shown for is its ability to mitigate that process. So that's going to happen at a slower rate. So rather than going like maybe like down at a slant like this, you're going a little bit more across. You're still going down, but not nearly as quickly. And I'm going to get into how this helps with chronic disease in a second, but this is just to validate kind of its use for oxygen efficiency for somebody who's healthy. They did a study where they treated these professional athletes that were soccer players. I think this was in Turkey. And they essentially found that they were able to run for much longer periods of time, and their VO2 max was increased, which is how much oxygen you're able to use as you're exercising. So really, that's like super impressive, by the way. Some of those statistics, like 28% VO2 max and a 20% increase in running time is like almost unheard of. And it's not considered a doping agent, but like with how much of a improvement you're getting, it pretty much is doping. Like it's really impressive. This is another one kind of saying the same thing, but yeah, go ahead.
Micah, that's huge. And so if you are someone who is a professional athlete, or you're trying to increase your athletic ability dealing with Crohn's, colitis, or other forms of IBD, IBS, that's another valuable option. And now we're talking about, two birds, one stone. Not only can I help modulate my immune system, but I can increase my athletic performance, my VO2 max. So it might be able to calm down my gut response while allowing me to be running my fastest 10-mile pace ever. And so that's very exciting for athletes out there dealing with autoimmune or IBD.
Yeah.
Go ahead.
It's nuts. It almost sounds fake. Like that was kind of my thought first getting into this stuff is like, how can something be used for gangrene and Lyme disease and yada, 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 yada? Like that just sounds like too good to be true. But you hit on it earlier where it's a balancing mechanism. So ozone is not the thing. Your body does actually natively create ozone, and that's like published in Science, which is like one of the top journals. But it's causing a stimulus to the body. So whereas a drug is kind of like forcing a certain response in the body, ozone creates a stimulus or a platform for your body to be able to do what it does well. So the difference there is that we're creating an opportunity for our body to do what it needs to do rather than forcing it to do something. And that's a really important distinguishment, because if your body is performing well, it's going to outperform any drug. And so that's really what we're doing. And that's why it can be used in so many different applications, is because it's not ozone. Ozone is a catalyst, like it really does help, but it's the fact that it's a stimulus and your body takes it from there. So essentially, when you put this into the body, your body does this little like kind of overreaction thing where it's like, oh, shoot, I need to fix a bunch of stuff. And then it just kicks on all these systems that it needs to do. And it doesn't just jump up to where it needs to go. Like if you're too high, it also brings you down, which is what makes it super fascinating. That's like the same thing, by the way, that you would get from like exercise or doing a sauna. Is it's like, it's not the sauna itself, although that's the catalyst you need. It's what your body, the reaction it takes from that sauna. And that's what ozone is doing too.
Yeah, a balancer, and it's the catalyst, which again took me a while to really understand. So let's say it again. It's not the ozone doing it. The ozone is a catalyst for your body to get the reaction that we want, right? It's
Yeah.
the match, and then the body's reacting to that match. It's a form of oxidation that's causing a massive surge of antioxidants to flood the body.
Yeah. Yeah. Exactly. So your body,
That's genius. So your
just no.
body's doing it.
Uh-huh.
We're not
Exactly.
using a drug. We're not using an outside thing. We're giving the body something to create a catalyst in the own body's human divine creation. I mean,
Yeah.
this is so beautiful to me,
It
and
is like, and most
it
people just
balances.
glaze over that point, but it
Yeah.
is really important to
That one
understand how
took
that's
me a
different.
while. Yeah, I wanted to repeat
Yeah.
it because it was like, wait, oh, so it's really the body. It's really at its deepest form a natural response. And
Yeah.
as you said, ozone's already in the body. Ozone's already at the top of the earth. I mean, we are finding its divine connection to us and this planet everywhere. So fantastic, fantastic stuff. Sorry to interrupt, Micah.
No,
I'll try not to do it too much. Let's keep going.
it's cool. I kind of get in the habit of saying that, and then most people just kind of gloss over it. But it is a very important distinction because it's apples and oranges. Like, it's a totally different thing. Like,
Yep.
to be able to say that, like, you couldn't say that with antibiotics. Like, no, they're just ripping through your gut, causing havoc, right? So,
And one other
um,
side note I want to say, if anyone's getting really interested and excited about this, all of the information is going to be in the blog below, plus a link to Simply O3 with where you could purchase it. I'm going to put down just what I use, the rectal insufflation, so you're getting the most cost-effective plan, plus a discount from us that Mike has been so gracious to give us, to give to our entire community. So everyone's going to get that discount below in the blog if you want to check it out. We're going to be diving in just for those who need to drop off or run somewhere. It's all in the link below, all the information. Plus, we'll put some clinical trials or some of those research papers below so you can further learn more about this. I know it took me a long time of kind of researching to really wrap my head around this idea of ozone. But let's keep going, Micah.
yeah. So here's another one on the topic of oxygen efficiency. So again, oxygen for making energy. Well, we looked at athletes. What about the other side of it? People who are sick. And what's better than chronic fatigue syndrome? People who have like a energy deficiency, right? So in this study, they took 65 patients and they measured how severe the chronic fatigue syndrome was. Then they applied ozone therapy to these patients. And what they found is over 80% of the patients had over a 50% improvement in symptoms. This is just one tool. So like,
Wow.
this is not like the end all be all again. But that is absolutely incredible for one tool to have that big of an impact on something as difficult as chronic fatigue syndrome. Like, that's something that people can't get out of, like Crohn's. It's just really, really tough to figure out.
Well, chronic fatigue syndrome is a huge problem with IBD, the lack of energy. And I can attest that since I've been doing ozone, I do notice an energy spike, especially in the first hour or two after doing it. But yeah, let's keep going. What was that next one? That
Well,
looked pretty gruesome.
and also, just for the sake of transparency, this was with IV ozone, but we will cover how rectal is kind of like a counterpart to that. And then I'll kind of talk about that a little bit. So microcirculation, I know this is a little bit of a graphic picture here, but this is a gentleman who has basically tissue that's dying on his feet because he's not getting proper blood flow to the area. And so you can kind of imagine the same thing happening on a really small level to our organs, our brain, all the different important parts in our body. And that's what microcirculation is doing, is it's allowing nutrients and gases and things that we need to get to all sorts of parts of our body. And when we get sick, we decrease in that ability. And when we age, we decrease in that ability. So it's really important. And ozone therapy is kind of next level in its ability to modulate microcirculation because it works with things like peripheral vascular disease, peripheral arterial disease, and pretty severe issues within that. I accidentally had this slide in here, but this is spike protein causes clots, which is an issue that's been arising in the last few years. And there's a lot of clinical observations on ozone resolving that.
Okay, so we're seeing that the ozone helps with the circulation of blood, which carries our oxygen, which is also going to help in the healing response. And if you're anemic, and if which is also going to cause low blood circulation, you're not going to be able to heal as well. And so if we can get that circulation moving throughout the body, that might also cause more of a healing response in places like the colon or large intestine, where we might have ulcers and damage and leaky gut and things of that nature.
Yeah,
So we're having a
exactly.
systemic increase in oxygen throughout the body, which is needed to heal.
Well, yeah, and here's an example of how circulatory issues, like what are the problems they cause. In all these clinical trials, which you can go and read, which means that they're pretty um, pretty impactful study, like that they're pretty quality. Yeah, people are getting more inflammation, more pain. Their brain isn't as healthy. They don't heal as fast, and so when you improve circulation, all those processes improve. And this would be an example again of how this works with like stroke patients or people who have a traumatic brain injury. Is that this was actually a more interesting study just in the fact that it was kind of selective. So it was almost intelligent. But again, this goes back to the point of why ozone works in so many different capacities, is because in this study, what they found is if patients were not hypoxic, meaning they already had proper blood flow to the brain, ozone didn't affect it. Whereas if they were hypoxic, it did affect it drastically, like a 30% increase. So what that means is it was almost like intelligent in what it did. But again, it's not the ozone, it's the intelligence of your body. So we're creating a catalyst for the intelligence of your body to take place. And that's why this can be helpful with like stroke patients and traumatic brain injury. This is another study on, this is more about preconditioning, which means that if you say you're going to get into a car accident, which I hope nobody plans that, but say something traumatic like that is going to happen. Let's pretend you did ozone therapy prior. You're actually going to be more equipped to handle the stress of that event than if you did not do ozone therapy. So in this study, they had rats and they had different groups. And one of the groups did ozone therapy prior to them inducing a heart attack. So they would do, one group they didn't do anything, one group they did infrared light, and one group they did ozone and infrared light. Then they gave the rats a heart attack. And the ones that did ozone almost had perfect heart condition afterwards. Wow. So it allowed them to handle the stress of that situation much more effectively. So there wasn't nearly as much mitochondrial damage and just damage overall.
Well, that's an interesting point. I mean, a car accident, or I'm sorry, a heart attack is a huge thing to happen, but would you agree that a smaller stress could have a similar protective nature, such as someone with IBD breaks up with their significant other, loses their job, is having stress with their kids? Those types of micro stresses, would you say something similar could happen where the body could be more protective over all sorts of stress to reduce the chance of a massive flare or reaction?
Yeah. So what it's essentially doing is that we're putting this stimulus into the body, and the body kind of does this little freak out, but then it corrects a lot of stuff. And one of those things is antioxidant production. Antioxidants are really important for the health of the cell and just the body in general. So if we have proper antioxidant production in those cells, which is better than supplementing, by the way, because now our cells are creating them. Like, I want it made from my own body rather than needing to take it in from the outside. So now my cells are creating this protective element that allow me to, whatever I go through, to be more protected on a cell level than if I had not done that.
I want to give a quick testament to this, Micah, too, because you're saying something very smart. We have certain members, and one of the reasons I got into ozone is we have some of my team members who've all had Crohn's colitis for 10, 15, a lot of them 20 years, have been using ozone way before I even started. And one in particular, Lindsay, has been diagnosed with Lyme disease, asthma, and ulcerative colitis. She got ulcerative colitis when she was around 14 years old. She came to me and started working with me at 29. It was like 27, 29 years old. I'm not sure of her exact age, but somewhere in there. So we're talking most of her adult existence. She's had severe ulcerative colitis, 4 bowel movements at night, 12 to 15 during the day, tons of blood, cramping, urgency. I mean, a mess. She has not had a symptom in about 2.5 years now. And one of the things she's been doing is she's been doing small amounts of ozone 4 to 7 days a week with rectal insufflation. And she says it's one of the things she believes has kept her so stable for so long. I mean, she's not getting Lyme reactions. She's not getting asthma reactions. She's not getting UC reactions. And I mean, she was sick for 15, 16 years, her entire adult life. And I have witnessed her. I privately worked with her for a year. She's now been working with my team for over a year and a half. She's been good the entire time. And ozone, she believes, is one of the things that's been keeping her so good. So that's a testimony to why I even started looking into this with someone with multiple immune issues. I mean, asthma, Lyme, Crohn, we're talking autoimmune triggers everywhere. row, and she's not having any of those issues and just doing a small amount of ozone gas. Takes her 5 minutes a day, and she's done. It's been one of the baselines we think to her long-term success. So I just want to throw that out there to what we've seen in our community.
Yeah, and it's incredible. Like you said, you just kind of get to marvel at the intelligence of your body. And quite honestly, there's possibly other stuff out there that interacts like ozone that we just don't know about. Like we're just talking about ozone today because that's what we know about that has research on it. But
It's natural
I'm sure
and it
that,
works. Yeah.
yeah, and I'm sure there's some other stuff out there that we just don't know exists yet. And hopefully we'll find that in the future. But again, this slide, we kind of laughed about this at first, but all this means is that ozone is the catalyst for balancing out these very complex systems in your body. Mm-hmm. So you have kind of this war that's always happening in your body. And what it is, it's this very delicate balance between like free radicals or antioxidants, or this cell and this cell, this molecule and this molecule. And what the body is trying to do is do this balancing thing called homeostasis and keep everything in line where there's these really tight loops, because you don't want it going one way or the other. Like sometimes we think of a molecule as like good or bad. Like some people hear of like glutathione and think, wow, that's a really good molecule. Yeah. Well, not if you have way too much of it. Like there's ways to overdo it, and your body needs to have this really tight balancing system. And that's what ozone is facilitating. So, but in most cases, glutathione improvement is good because we often have an antioxidant deficit. Mm-hmm. So this is a study that was done on chemotherapy, and it was a pretty good study. What they found was what I was saying is that protective element. People who are undergoing chemotherapy and did ozone prior and during the treatments had a 70% improvement in overall quality of life. Wow. So that was in fatigue, that was in nausea, that was in all those characteristic chemotherapy side effects were diminished by 70% if they did ozone. So if you know anybody doing chemo, like I think it's like a no brainer because it just helps so much. And then
Well, let's take that to layman's terms real quick, because our whole theory here is that ozone helps to modulate the immune system. If it's too low, brings it up. Chemotherapy, a lot of time, really hurts the immune system and drastically weakens it and potentially kills off our white blood cells. That this is already helping to bring it up. It's helping to increase the antioxidants to control the body. Chemo is obviously a massive stress in the body, which goes back to the heart attack on the rats, that it might be helping be a catalyst for the body to protect itself against such an extreme stress like chemo. So it's going back to that same rhythm, that same theory of how is this going to help me with my major stressors, my autoimmune, any of that. Let's keep going.
Yeah, and I mean, chemotherapy is, it's a very, very toxic thing to the body. So if you can diminish the effects of that by 70%, you can kind of bet on it's doing that for a lot of other stuff. So I threw on a couple slides here real quick. I told Dane that I had a slide set last week and I don't know what happened. So we put some things together real quick. But in this study, they said ozone therapy combined with, I can't pronounce this word. How do you pronounce it? I can say it in my head,
sulfasalazine.
Yeah, sulfasalazine delivered via colon therapy system is feasible and effective treatment for ulcerative colitis. I know that's
it's like mesalamine with sulfur. Some people have such a reaction to sulfur they choose regular mesalamine, but it's a stomach coater. It's an anti-inflammatory. So they're saying something like mesalamine or sulfasalazine mixed with ozone they found was a feasible and effective treatment for ulcerative colitis, inflammation and damage throughout the colon, which is amazing. And I'm assuming this was rectal insufflation.
This is colon therapy system. So and the takeaway from this is it didn't give us a lot of like information on like protocol and what to do, but we have a lot of other studies that kind of do that for us. So, but in terms of ulcerative colitis, they are doing some studies and seeing some pretty good results with it. This is another one on inflammatory diseases, but they said the integration of OAHT, which is ozone therapy, with effective approved drugs, and some of these people aren't quite in the natural mind. So keep in mind, these are researchers just being like, ozone, that's interesting. Just combine that with this toxic drug and we're good to go, but is likely to yield the best clinical results in several chronic inflammatory diseases. And going back to those kind of fundamental things of immune modulation, oxygen efficiency, microcirculation, oxidative stress, correcting those really helps with inflammation. It starts to autocorrect a lot of these other things up the pipeline, so to speak.
And
And just,
inflammation is the big bad wolf with all disease. I mean, it's
yeah.
helping to correct that pro-inflammatory cytokine response. It's mitigating the inflammation, which is the main source of all cancer growing, which is the number one problem with all forms of IBD, inflammatory bowel disease. So if we can calm down that cytokine reaction, if we can calm down that chronic inflammation, we can potentially mitigate the whole autoimmune experience or the inflammatory experience.
Mhm.
I mean, this is how big this concept could be, and we're doing it as a natural catalyst. I'm in the body. I mean, it's so exciting. I got to keep repeating it, Micah. But
Yeah, yeah, no, it's cool. I'm glad you get it because like a lot of people don't understand that
yeah, it took me a little bit to get it.
distinguishment.
Yeah. Mhm.
There's a lot of different, it's studied in over 150 different diseases. Okay. So there's a lot of different ways that it's applied for a lot of different diseases, again, because of those fundamental actions. But this is just a quick testimony video: stroke patient, and then a mold patient, and then infertility. So it's just kind of like a more generic, but I love these because I think these stories give the life behind it. Like we talk about all these studies and results, but like to actually change somebody's life, and I'm sure you've experienced that, it's like it's very emotional and very impactful, very fulfilling. And these stories kind of stick with us, and that's why I like to show them. So I'm going to do this quick 1 minute video real quick.
I found out we both had mold in our bodies. Lives were like a roller coaster we never got on voluntarily. First time she went to an ozone therapy session, she went to a med spa and had one session, and she came out of there in the parking lot and said, "Mom, my derealization has dissipated for the very first time." And as you can see, I'm actually able to put sentences together. I don't have a problem recalling words anymore. She no longer has nausea. She no longer has her headaches. Ozone, just like Dave Asprey, has been the key to our healing, and I cannot recommend it enough.
Wow,
Okay.
Micah, that's amazing. And we're seeing that the variety of problems because of those fundamentals you said that ozone can help with. And so absolutely amazing. So what else? I mean, is there anything else you wanted to discuss before we go into how to use it and some of those baselines of what someone could do next to use ozone?
Not in particular. I'm just, yeah, I love this therapy. Like I said, it gives a lot of life to people. So that's super exciting. Or going to conferences, like people come up to me all the time and say how it changed their life. And
Oh,
yeah, super,
beautiful.
super cool. It's
So
awesome stuff.
excited. So let's really quickly just recap the statements of how ozone could help someone with autoimmune IBD and obviously hundreds of other diseases. But right now we're seeing acting as a catalyst to balance the body, to balance the immune system, to help and balance antioxidants in the body and glutathione levels, so it can create a enzymic reaction of antioxidants going throughout the body, which, as we said, fundamental can help with all sorts of problems: infertility, MS, speech impediments, Crohn's, colitis, all these different things, blood circulation and oxygen in that blood that could help with a healing response or help with people having, as you said, their lack of blood flow to their feet causing systemic issues. What else? What else? Am I missing anything on these big values that ozone can do in the body?
Oh, I mean, we could do a whole thing just on the different indications, but a lot. I mean, it's just again making your body healthier so your body is capable of fighting disease better and
Yeah,
preferably aging a little bit more gracefully. So
reducing and yeah, we're helping to reduce the inflammation, which could also help to reduce the amount of cancer cells in the body. And we've even seen a decrease in tumors. I mean, that's not what this topic's about, but just so much value. So now let's jump into how to use the Simply O3 machine. And I have one. I've been using this. I've been using the Ozone machine about 4 or 5 days a week for the past about 2.5, 3 months. So still a bit new to it. And for everyone out there listening, if you're new, I'll try to go over some of the new things that I learned and kind of had to do some research to figure out. But Micah, maybe you can help us just kind of go over. So I have my ozone set up right behind me. And what I did is I just bought this medical device to put my generator on, which has a tube connected to my oxygen tank. I got my oxygen tank on Amazon. I'll link it below as well. And then Micah, what is this connected to the oxygen tank? And then what is the oxygen tank connecting to down here?
Yeah. So essentially, a tank of compressed oxygen, and then that piece right there is what changes how fast the gas. It changes how fast the gas comes out of the tank.
Right
So
there.
that's yeah, and
Yeah.
that's important for ozone therapy because depending on what we change that to, that's going to change how strong the ozone coming out of that machine is. So you have your tank connected to what's called the ozone generator. And so the oxygen flows through this machine and it adds an extra oxygen atom onto the gas. And then
Mm.
that gas is going to be coming out right of the top there. And that's where we put like a little bag to collect the ozone. And then, yep, right there. And then once we get our bag get the amount of gas we want into that bag, we take a catheter, put it where the sun don't shine, and that's pretty much your therapy. The whole thing, once like it probably will take about 2 hours of learning curve to just like kind of sit down and be like, I'm going to figure this out. Hour, maybe even just an hour. But it doesn't take long as you just have that mentality as I'm going to figure this out. And so the first time is like an hour. From there, it's like 5 minutes a day or less. It's really, really quick.
Very
So
quick, very
yeah.
quick. And so the oxygen's in here, and this tank, by the way, guys, I'm gonna assume right now I turn it on, it's still at 2,500 psi. I'm probably gonna get a good 500 uses out of this tank before needing it, and there's no other cost to keep this going. So once I got my tank and got my generator, there's no other cost. I can use this every day, and all it needs is a little bit of air, and I'm good to go. So this right here has a knob that controls how much oxygen goes into the generator. And then up here, you're going to see the number. It's hooked up, so I can't pull it close to the screen, but I'll get some close shots for you guys. It shows you the number right here, which is the setting up here that quotes the intensity. And then it shows you the gamma, which is, a measurement for how much gas it's allowing, how strong the ozone gas is. And then down here. Now, I personally like to keep my experience. I've been keeping my gamma, which is how strong the ozone is, around 10 to 15. I went up to
Mhm.
20. I felt it was a little aggravating. Some places you go to will just give you 40 gamma. I've had a few members go out and say, hey, I want to try ozone. I'm going to go to this clinic. And they've given them a bag of ozone at 40 gamma, which is the strongest you could possibly do with rectal insufflation. Correct, Micah?
Yep.
Okay. Me personally, I don't want to start with 40 gamma. I want to start with 8 gamma. And what was interesting, I've done detoxes for years. When I did 8 gamma the first time, I did around 700 mLs. Okay. So this bag, see this first pocket? If I pinch there, the gas will only fill up to there. That's 200 mLs. If I pinch right here, the gas will only fill up to there. It'll go through this compartment into this one, and it'll fill up to 400 mLs. The whole bag is 750 mLs. So I filled up almost the whole bag, which was a mistake, had 8 gamma, and I did it. And when I released it, I got this almost like what you would experience as like almost like a diaper rash. It felt like it was something was irritated, it was a little red. It went away in a day, but for me, that was a bit of a Herx reaction. First time ever trying it. Then I did it every other day at 8 gamma at only 200 mLs and just waited for my body to get used to it and experience it. And then I started noticing no problem. I started noticing even better formation. I started noticing more energy, more mental clarity. I had dealt with a little bit of adrenal fatigue from working so hard, and I felt like it was helping me get through my days, taking on the stress of running a company. So, and then I've slowly worked up, but again, I have not moved it up that much. And a lot of our members who've been doing this for a long time have had similar experiences where they actually keep the gamma a bit low. So it's not like you go from
Yeah.
8, 10, 15, 20 over 1 week, 2 weeks, 3 weeks that you might do with another detox. This, we're finding long term, keeping it lower has been more effective for many of our members who've had Crohn's colitis for 10, 15 years, some of them 1 year, 2 years. So don't need to go massively high. So when I turn it on, I just turn this, the gas is on, I put it on 1, okay, and it's gonna start going, tss. It's actually gonna come out faster at a lower gamma, okay? I'm gonna put this on, so now it's attached to the bag. I'm gonna make sure this clip is open. If I clip it, it'll pinch the gas in, so then you can walk around, the gas isn't gonna leak out. But at 1, you can see it's already starting to fill up. You see how fast it'll fill up? You gotta turn it on immediately, and then put it in. It'll go in very quickly. Now, if it's stronger gamma, it'll go in slower, okay? So you don't even need it on that long. You can take it off when you're done, and then you can add a catheter which is right here. And the catheter goes on the end of this, and then I'm going to pinch this, and the gas is stuck in there. Now I know there's a little ozone in the air, and that's okay to have a little bit, as we said, because I can kind of smell it. It has a distinct smell.
You can smell it, just don't breathe high doses for long periods of time. Smelling is totally fine.
And I am going to open the window just to help that whole situation go. So now I have it in here. It's pinched in here, and this is just 8 gamma. And then you can put it in. You can see how small that is. These are the air pockets. And there's a little line that shows you how far it wants to go. These are reusable because you're only using it on yourself. So you want to clean it in some hydrogen peroxide, rinse it out. You might get a little bit of goo on the end of it from things like I put a ozonated coconut oil on the end to help it go in. So if you have a little lubricant, it goes into the rectum a lot easier. And you can even use one of these. So little tiny hacks, guys. I use one of these guys. These are like, I call them finger condoms. And what it does is if you have nails or dirt or you don't want to put that around, you can put some lubricant around the anus or inside a bit to help make sure that catheter goes in, and it goes on just like that. So you can put oil around here, rub it around, a bit inside, it'll help it go in. And also if you have a little bit of an anal fissure or a hemorrhoid right there, that cream can help calm it down, especially before bowel movement. So those topical creams are very useful. And you can throw these away. I get them on Amazon. I'm gonna put a link below if you want one of those. I'll put the 2 salves I use below as well to put it on. Excuse me. Then this is good to go, and it's pinched, okay? So can hold it up. You usually want to hold this upright because the gas will actually come down with gravity, right, Micah? So the gas sinks. So you want to hold this up here. And then I'll usually put a towel down on a blanket, sit down, insert this about 2-3 inches, not far, with some kind of lubricant to make sure it gets in there. And then I will start rolling the bag in. So I'm on my side, and then just relax your entire body, one knee up on the side, and then slowly start that. Now this might make you feel like you have to release gas, fart, okay? That's okay. What's been recommended is to keep it in for 30 seconds and then you can release it, all right? It might cause you to have a stimulated bowel movement. That's okay, okay? So, but you want to preferably try to hold it for 15, 30 seconds. I'll usually get the bag in over 1 to 3 minutes and then just hang out and move from there. If I have to release the gas, that's fine. Now, Micah, you could confirm this. If someone puts it in there and they immediately have to release the gas, does it still have an impact if it's only in the colon for 1 to 10 seconds?
Yeah, it will. I mean, maybe at 1 second you're starting to diminish it a little bit, but yeah, 30 seconds is ample time. Realistically, probably 10 to 20 seconds would be kind of something to shoot for. But yeah, it has a very fast reaction time, and the parts that you need are absorbed very quickly.
And it goes through, I know that it's when you put it in 3 inches, it's right next to some kind of, I can't remember the word, maybe you can remember, some kind of valve or vein.
Portal vein.
The portal vein that helps it go systemically through the body very quickly. And this is an oxidant, so it's going to cause that antioxidant enzymic reaction very, very quickly. So again, another benefit is you don't have to hold this in your colon like an enema for an hour, 2 hours, 3 hours, try to make it absorb. This is very, very quick. And then once you release it, you could have a bowel movement, you could do a suppository afterwards, a lot of cool stuff. And these bags are reusable. Plenty of time. So again, I mean, one thing I love, I don't really have any expenses. I mean, I set this up, I can use it any day I want, especially useful before I go on a plane ride, or I think I'm going to be around any viruses traveling, or if I'm dealing with adrenal fatigue, or just on a daily basis. It's something we could, I could show and do, have my wife learn how to use, especially if we want things like get her immune system up, or dealing with infertility, as one of your testimonies just showed. I mean, so many different ways. And it's a one-time investment to get this set up. You always have it at home. You can do it wherever, but this bag doesn't last. So Micah, if I have a bag of ozone and I'm thinking I'm going on a 3-day trip, I'm going to pack 3 bags of ozone. What happens to the quality of the ozone after 20 minutes, an hour, things like that?
It turns back into oxygen because it is unstable. So that means it'll just go back to oxygen, and it'll all be oxygen in the bag and no more ozone.
Okay. So you can't, if someone says, hey, I want to try your ozone, they need to be using it same day to really get a response.
Ideally right away. I mean,
Ideally,
even
right away. Yeah.
same day. I would say if it's been over 30 minutes, fill it up again if you can. But yeah,
Yeah.
it's pretty quick. So you want to use it pretty quickly.
Use it. So try to use it immediately, guys. This is not so hard to travel with. One last thing is this tank is the government allows us to buy this tank. If you want a smaller tank, I think it's called a 503, Micah, then you actually need a prescription from a doctor to get that tank, which it's the exact same thing. It's just the size of the tank, but you put oxygen in. And so this one I found was much cheaper. When I went to buy a tank at a local store, it was like $300. I got this one on Amazon for like 120, 150 or something like that. So it was much cheaper. But Micah, can you also really quickly talk about the discrepancies between the two tanks?
Yeah, so one is considered a medical tank, which means that it's regulated as a drug. So you need a prescription to get access to medical oxygen, which is 99.9% oxygen. However, there's a lot of other industries that still need oxygen and they need 99.9% oxygen. So you can just go and buy the same thing. They fill it from the same spigot, so to speak. So it's
Yeah.
the same thing, it's just in a different tank and it's not regulated by a medical board. So that tank you can go into like Airgas, Praxair, Weld Supply Shop, and you don't want to tell them, hey, I am doing this for some alt therapy, like, because then they're going to be like, oh, what's going on here?
Yeah.
But just say, I need a 40 cubic foot oxygen tank. Just like if you didn't know how to order a cappuccino, you don't know to say, I need a 16-ounce cappuccino. This is the same thing, just oxygen tank. So all you need to say is 40 cubic foot oxygen tank, and they should bring you one.
Should bring you one. When I had mine filled up at, I think it's Prox Air, as you named, I just said, hey, here's a tank. Can you fill it up with air or oxygen? Yep, sure. Pick it up tomorrow. That was it. And again, it will last me forever. No other major expenses, which I love. I can get these catheters changed out and get the bags very cheaply whenever I need. And yeah, if they do say, hey, what's this for? You can say something like you're building a ozone water machine or something of that nature. But no one should really give us a hard time. Mike, I think that's it. Everyone, if you're still with us right now and you're learning so much, please like this video, please subscribe, and please post comments or parts that you really loved and show that appreciation, show that love. It really means a lot to us and helps the channel. And Micah, if you have any last words or any last comments for anyone who's wanting to get started or very interested in ozone or wants to learn more, what would you say?
Yeah, it's a really good therapy. It's easy to do. It's safe, and have fun with it. It's
Okay.
awesome. Gets you good results. So kudos to you. You're a rock star, Dane. I really appreciate it, man.
You too, brother. Thanks so much, guys. See you on the next one.